Hello, welcome to the first episode of Operation Dissecting the Body of Healthcare. I'm one of your hosts, Wyatt Kaiser, and I'm here with Owen and Christian. And we're all pre-med students, recently graduated, currently applying to medical school, and hopefully will be attending in the fall of 2021. A little bit about me. I'm from Nashville, Tennessee, lived here my whole life until college. I decided to venture up to Dayton, Ohio, and entered as a mechanical engineer. Sophomore year, I joined the Hospice of Dayton organization and really enjoyed working with patients through that realm. And I ended up changing majors to pre-med, graduated with a minor in English, medical humanities, and biology. I culminated my studies with a honors thesis that looked at different documents hospitals were giving out and examining them and hoping to kind of improve that process of medicine. For this next gap year, I'm going to be living at home, saving up some money, working as a pharmacy technician, and hopefully learn more about insurance, policies, and different medications while also talking to doctors and pharmacists. So that was a little bit about me, and I'm going to let Owen tell you a little bit about himself.
Yeah, guys, so I'm Owen Clark, also here from the Nashville area. I grew up in White House, Tennessee, a little bit north of Nashville, and then for undergrad, made my way down to Birmingham, Alabama. I went to Samford University, where I studied sports medicine and also got a minor in biology. Quickly, we'll probably go into more of this later, but quickly for me and why medicine, always kind of grew up with healthcare workers around. My mom was a nurse. My brother's a nurse now, going to nurse anesthesia school. So it's always been a part of my life, always been interested in the sciences of it and physiology, just kind of how the body works. And then also in high school, I had my own personal experience from the patient aspect of things. I was diagnosed with a chronic illness, and through the couple years that it took me to get into remission, I had a lot of different experiences of my own. Some of those were good, some of those were not so good, but through it all, I was able to learn a lot and through those experiences of mine, and I'm excited to be able to use that as a bridge to reach other patients one day, just having the confidence of understanding the experiences that they're going through and the emotions that can also come along with that. And then just medicine in general, I think it's a really exciting field because not only does it present the opportunity for me to go to work every day with the platform to serve someone else, but it's a platform to serve people from all different walks of life, just kind of all, whatever population they're from, whatever economic status they come from. Medicine is a career that can serve people from all around. So that's something that really excites me about medicine, and I'm looking forward to, just kind of diving into that. And then I'll let you hear a little bit about Christian and, his passions.
Yeah, so last but certainly not least, I'm Christian Roberts. Went to Berry College for undergrad, small school in Rome, Georgia. There I majored in economics, had a minor in chemistry, and I played college soccer all 4 years. So my dad's a physical therapist, and he really taught me about his field, about healthcare in general, and learning about his experiences and his passion for working with others. That really excited and started me on the path down wanting to become a physician. So in high school, our school really focused on community service, giving back to other people, and from whatever platform that we have and whatever standpoint in life that they're at. So I really enjoyed working with other people, got a lot of interesting experiences and stories and learning from them and providing whatever insight I could for them. And so I carried that forward going into undergrad, really started to explore medicine and healthcare in general. Right as a college athlete, I spent a lot of times with athletic trainers, physical therapists, physicians, and so got to see it from a bunch of different angles and start to learn really how complex healthcare is. And so that's kind of one of our goals with the podcast. But as I carried that forward, I had the opportunity to shadow a lot of physicians, work with patients hands-on. And so one of my big passions for medicine is working with underserved populations. So having an economics degree, and recently I graduated with my MBA from Belmont, I've really gotten to see all the struggles that they face, not only from a healthcare standpoint, but socially, familial areas, economic burdens, and so a lot of different components culminate into the issues that they face. And so that's a big passion and goal of mine to help address those issues right now and going on as a physician. So a little bit of how we know each other. We've grown up our whole lives together, been best friends ever since we were young, playing soccer, and so we saw this year as a really good opportunity. So this is our gap year, right? And so we saw this as a good time before we get into the weeds of medical school to really start diving into why medicine for us and looking back and explaining what stories we have, what insights that we can give to you all. Right, Owen and I have gone through the admission cycle twice now, and so looking back just from a year ago, what we've done wrong and how we can help you fix that from an early standpoint. So this applies to high school, pre-meds, everybody that really wants to get into this, and so we hope to start you on an early path and really learn from this all.
Yeah, and like Christian was just saying, I guess a little, less about us and more about, the goal of this podcast. It's really just a space for us to kind of talk things out and learn, and for you as our listeners to learn along with us. There are areas that we'll be able to discuss from personal experiences, like Christian talked about, the application process, but there's also areas that we're not necessarily going to be professionals in, because there really is just a lot to learn about the healthcare process in the U.S. Currently I'm kind of serving with this clinic in Nashville that reaches patients from over 80 different countries, and it's just kind of opened my eyes to how difficult it can be for those people to navigate our healthcare system in the U.S. because it really is such a large system and there's so much that goes into it. So it's something that we're really excited about unpacking and, bringing in guests to discuss what they know about certain issues and what they've learned kind of through their field working as healthcare professionals and the challenges that they may face and the solutions that they've seen work with those challenges and things that they've seen, haven't worked so well. So it's just going to be a great learning opportunity, not only for us, but for our listeners as well, as we can just unpack the kind of broad area of healthcare in the United States and the many different topics and issues that can include.
So yeah, we're very excited for this podcast over the next few months, and that's all we have for you for the first episode. But whether you're a pre-med student or a medical student or someone that's simply just hoping to learn more about healthcare, we hope this podcast can be good for you. And we're hoping to upload weekly, so stay tuned for that, and we hope to talk to you in the next one.